Hey there everyone, this is Dr. Mike Glickert with the Vanguard Clinic, and I had a question recently on fish oils, so I wanted to shoot a video on kind of some specifics about them and hopefully help educate you a little bit so you can make the right choice when choosing a fish oil product. So let's talk a little bit about what each fish oil product is made of, and that's a combination of EPA and DHA. Now, EPA is eicosapentaenoic acid, and DHA is docosahexaenoic acid. I won't write them out because I'll probably spell them wrong, but so each one does something a little bit different in our body. So EPA is really good at lowering LDLs. So LDLs are the bad cholesterol in our body. It's also been shown to have a little bit of a antidepressive effect, and it's a little bit better at aches and pains in your body. Now, it's a little bit different than DHA. DHA is really good at decreasing and reducing triglycerides, increasing HDL, which is the good cholesterol, and it's been good for brain function. It's supposed to be a brain. So it increases cognitive function. It's also been shown to be very beneficial for patients suffering with things like mental conditions later in life, cognitive decline and whatnot. Now, each one is very different, and each one does a very different thing in our body. So you got to look at what it is you're attempting to do, what is it that you want to do with your health, and look at the ratio. I've seen products that have a huge EPA to DHA ratio, 10 to 1 EPA to DHA. I've seen it very high DHA, about 6 to 1 or whatnot, DHA to EPA. And so when you're choosing a fish oil product, you got to look at what's the ratio and what it is that you're trying to do. In my clinic, we typically stick with as much DHA as we can, just because the benefits I find are a little bit better with DHA than it is for the EPA. So we stick with products that are mostly heavy on DHA. So let's get rid of this. Next thing that we got to talk about are the omega 6 to 3 ratios. This comes from our diet. Now, omega-6 and 3s, this is why fish oil has become so popular, because a fish oil is an omega-3 supplement. There has to be a ratio of 6 to 3s. In a typical Western diet, we get anywhere from 10 to 25 to 1. So that's 10 to 25 omega-6s to 3s. We ideally want to be around 4 to 1. But also, you got to keep in mind that some diseases and responses respond better to ratios as low as 2.5 to 1. Some respond better to 6 to 1. Depends on what condition you have and your diet. Diets that are high in omega-6s are going to be diets that are heavy in vegetable oils, polyunsaturated fats like soybean oil, margarines, shortenings. Fast food, there's typically processed foods are not very good because they raise that omega-6 to 3 ratio up to the 10 to 25 to 1. So supplementing with an omega-3, if that's your diet, is going to get that ratio a little bit closer to 4 to 1 or 2.5 to 1. So what does that mean long term? Excuse me. Studies have shown that ratios of 10 to 25 to 1, that high, has been associated with cardiovascular disease, cancers, inflammatory diseases, autoimmune disease, whereas ratios around 4 to 1 or 2.5 to 1 has shown a suppressive effect on those conditions. Also, we've seen things like asthma and rheumatoid arthritis respond to ratios around 4 to 1 and 2.5 to 1 respectively. So how much should you take? It really just depends on your diet. If your diet is really high in fast food, processed foods, maybe eat on the go a lot, you're going to want to take a lot more fish oil. If your diet is more paleo-based, vegetables, good high quality fats and proteins, you're going to need a little bit less. You may not need any at all. Personally, I take a DHA supplement and most of my patients do as well, and that's usually where we start patients to see how they respond to that before we add in too much EPA. You also got to check the source of the actual fish oil product. There are a lot. It'll blow your mind how many bad fish oils there are out there. Fish oil, since it's a marketing buzzword, there's a lot of opportunistic businessmen out there, business people that capitalize on ignorant consumers or people that don't understand how a good fish oil versus a bad fish oil, and buy bad stuff. They produce bad stuff for patients. You got to look at things called excipients. Excipients is a fancy term for what's added to the fish oil to make it pretty or taste a little bit better. Sometimes they add natural flavorings which can inhibit the body's ability to absorb the beneficial properties of it. A lot of them have parabens. You also got to look at where the source of the fish comes from. You want to choose a cod liver fish oil, something from the ocean. We see a lot of products that use farm-raised salmon that typically eat a corn-based diet. That's not even normal for a fish to do that. The benefit of fish oil is fish eat the algae and the plant-based products in the ocean, and they grow naturally, and that fish oil is going to be a higher quality than a salmon or a cheap processed fish oil. Hopefully that gave you guys some answers, a little bit of understanding of what you should and shouldn't eat. If you got specific questions, I'm happy to help. Give us a call, 314-625-8454. Again, Dr. Mike Glickert with the Vanguard Clinic. We have answers, we have solutions, we're here to help.